Well, let me go to another point then, and that was a comment you made about Medicare and Part D, and this I don't think is necessarily in the draft. Do you know what the Medicare Part B premium was in 2000? I'm not going to play a gotcha game here. It was about $45.50. In 2008, it was $96.40. Medicare Part D for 2009 was $29, which was 30% lower than the original projected when we passed Medicare Part D in 2003. I understand you issued a report yesterday showing that employer-sponsored premiums for health care doubled between, I think it's 2000 and 2008 for health insurance. Medicare Part B premiums have more than doubled, 110% increase in the same time span. And I think what a lot of people are asking me about when I was home in Rufus and Arlington and Fossil and out in my district, they're saying, if Medicare is going broke by 2017, and we're going to just expand and add all these people into a government-run system, and we can't get access to providers now when the government runs the system, which, as you know, is a big issue in rural areas, getting access to a doctor if you're in Medicare. They're saying, how does this new government-run plan going to hold down costs? And how is it going to expand? How are we going to pay for this is the underlying issue here. And the estimates, they're just saying, you talked about health insurance could cost us, or health coverage $4 trillion or something. This plan alone, I think, some estimates are that. So people at home are really struggling with the dollar amounts here.
Well, Congressman, the plan, again, that at least the payment side that the administration has put forward not only saves dollars in Medicare, but helps to extend the life expectancy of the Medicare trust fund, an important feature, and lower overall costs in the Part B premium for the beneficiaries who are currently paying, as you say, higher costs. I am a believer that Medicare has to get at the front of the lower cost, higher quality care for the beneficiaries of the system, and that we can be not only innovative but help to drive the best practices which exist now in various parts of the country to scale.
Right.
So that's really one of the intents of the new program moving forward.
I appreciate that, and I'll close with this, that I spent 5 years on a small community hospital board, and it seemed like Medicare gave us the most headaches, not the least reimbursement, but second to least reimbursement, and there was an enormous cost shift going on when the federal government was involved. And now you got this access issue trying to get to physicians that will even take Medicare patients. And so I don't want to see us create a government-run system that mirrors one that isn't sustainable right now. And so and you know as well as I do, some of the goofy rules in Medicare that drive seniors to the hospital to get, an injection when they should be able to get it at home. Telemedicine's a great thing, but if you're a provider and you're on the other end of the telemedicine, you don't get reimbursed for that consultation under Medicare. So there's a disincentive to doctors to participate. There's some things, irrespective of this debate, we could do to really improve Medicare, I think. Mr. Chairman, thanks for your generosity on the time. I know I've...
Sure.